Hello, everyone. My name is Renee Padiernos, and I am a rising second year MPH student at UC Berkeley School of Public Health Infectious Disease and Vaccinology program. It is my pleasure to present to you all the following study entitled Community Provider Treatment Practices for Gonorrhea and Early Syphilis in Baltimore City, Maryland. Here are my disclosures. This study focuses solely on gonorrhea, or GC, as well as primary, secondary, and early latent syphilis, which I will be collectively referring to henceforth as early syphilis, or ES. Incidence for these two sexually transmitted infections, or STIs, has been increasing all over the United States, including during the pandemic. This trend is mirrored in Baltimore City, where you can see in this figure, incidence has been increasing for several years, even before COVID-19. In order to help reverse these trends in Baltimore City specifically, this study will be looking into the compliance among healthcare providers and their practices to STI treatment guidelines. Prompt, appropriate treatment is critical for mitigating onward transmission, antibiotic resistance, and disease sequelae, examples of which are shown on the following infographic. Kindly note that appropriate treatment means treatment according to current CDC STI treatment guidelines, while prompt treatment means treatment within 14 days of diagnosis. Given the decreased funding for dedicated sexual health clinics, ensuring that community health care providers and their practices deliver prompt, appropriate treatment to their gonorrhea or early syphilis diagnosed patients is proving to be more critical than ever. Unfortunately, there is presently a gap in the scientific literature regarding this aforementioned topic. It is this gap that this study is trying to shed light on. In order to shed light into said topic of provider practice level STI treatment compliance, this study will be utilizing the following research questions. With regards to each provider practice, what is the reported proportion for each performance measure below as it relates to its gonorrhea or early syphilis diagnosed patients? I'll go over these performance measures in more detail in the upcoming slides. These will be compared against benchmark compliance goals set forth by the Baltimore City Health Department, or BCHD. Data for this retrospective descriptive study came from the BCHD, which requires provider practices within its jurisdiction to routinely report positive gonorrhea and early syphilis cases. For gonorrhea, Baltimore City provider practices that diagnose at least one positive case from January 1, 2018 to December 31, 2019 were included in the study. For early syphilis, this period is from January 1 to December 31 of 2019. The measures will be described in the next slide. For analysis, treatment performance and compliance measures were analyzed using summary statistics such as median and IQR. Treatment performance and compliance were aggregated at the level of the provider practice. Percent treated is defined as the number of treated cases with documentation from each individual provider practice, divided by the total number of cases that it diagnosed during the assessment period. Appropriately treated is defined as the number of cases that each individual provider practice treated according to the 2015 CDC STI treatment guidelines, divided by its total number of treated cases. Percent promptly treated is defined as the number of cases that each provider practice appropriately treated within 14 days of diagnosis, divided by its total number of appropriately treated cases. All of these performance measures were compared against the following BCHD treatment benchmarks, which I will be going over in more detail in a specific example on the next slide. In the next few slides, bear in mind that I will only be going over key findings and their implications. From January 1, 2018 to December 31 of 2019, 6,439 cases of gonorrhea were diagnosed among 216 Baltimore City provider practices. Just to orient you all to what these results mean, let's walk through the data for percent treated. First, using the following hypothetical example. Provider Practice 1 diagnosed 1,500 cases of gonorrhea. Of those, it provided any treatment to 95%, which is 1,425 cases. When this proportion is compared against the BCHD standard for percent treated, which I am highlighting here is greater than or equal to 90%, you can conclude that Provider Practice 1 met said BCHD goal. Therefore, the N in this column that I'm highlighting with the laser pointer will increase by one provider practice, not 1,425 cases. This underscores that the unit is the individual provider practice, not the cases of the STI. However, let's say that only 50% of 1,500 cases received any treatment. In this alternate scenario, Provider Practice 1 did not meet the BCHD goal for percent treated and therefore would be excluded in this column that I am highlighting with the laser pointer. Imagine doing this for Provider Practices 2 to 216. When this was done, it was found that half of Baltimore City provider practices reported treatment for 75% or more of their gonorrhea diagnosed patients. When this was measured against BCHD goal for percent treated, only 33% of the 216 provider practices met the BCHD goal for percent treated. The largest gap in provider treatment compliance was documented treatment, which I have emphasized here at 33%. This gap may be due to suboptimal reporting of treatment information to the BCHD patient and/or provider level barriers to return for treatment following diagnoses. Nevertheless, for the trend in gonorrhea incidence to reverse, allocating limited public health resources to improving treatment reporting and/or linkage of patients to treatment may improve treatment compliance for gonorrhea. Here are the key findings for early syphilis. From January 1, 2019 to December 31 of the same year, 523 cases of early syphilis were diagnosed among 95 Baltimore City providers. These results that I'm highlighting with the laser pointer indicate that a large majority of providers met BCHD goals for percent treated and percent appropriately treated. This is in stark comparison to the results you have all just seen for gonorrhea. Nevertheless, a gap in provider treatment compliance was observed at the provision of prompt treatment indicated here at 50%. This gap in percent promptly treated tells us that allocating limited public health resources to interventions on improving time from diagnosis to treatment may improve early syphilis treatment compliance and thereby help reverse the increasing trend of early syphilis incidence in Baltimore City. These data were collected prior to the COVID-19 pandemic and may not be generalizable to current provider treatment practices in Baltimore City or other settings. Nevertheless, it is analysis such as these that will help fill in the gaps in understanding with regards to provider level treatment compliance. Therefore, aiding in the development of appropriate indicators for improving provider practice compliance with STI treatment guidelines is a strength of this study. BCHD cannot appropriately allocate their resources for treatment compliance until they have a better understanding of current treatment practices. So gaining a better understanding of these treatment practices is the next step. Data from this study was used to generate treatment compliance dashboards for individual provider practices that provided data to BCHD during the aforementioned assessment period. In 2021, these dashboards were disseminated to those provider practices. To the right is an example of one of these dashboards. Evaluation of whether these dashboards improve treatment compliance for the individual provider practice that received them will be forthcoming. Additionally, work will be done to determine whether provider-level characteristics lead to variability in treatment compliance. This will help the development of interventions that will improve said treatment compliance. This concludes my presentation. Here are my references. Before I take any questions, I want to thank Drs. Jennings and Schumacher, as well as Nicole Thornton for all of their mentorship, guidance, and support. I look forward to working with each and every one of them to further expand knowledge about this topic of treatment compliance among Baltimore City healthcare providers and their practices. This will help organizations like BCHD to appropriately allocate limited resources to reverse rising incidence of gonorrhea and early syphilis in Baltimore City. Thank you all for your attention. I will now turn the floor over for questions.